Good afternoon, everyone. I'm Erica Narducci. I am the program director here at Cancer Support Community Delaware. We provide professionally led support groups, healthy lifestyle classes, and education. So today's little education seminar is just for you, ladies, whether you're a caregiver, a patient, a loved one, a family member, welcome. My agenda today is pretty simple. We're going to talk about healthy living, and we're going to talk about screenings and preventions. In full transparency, I am a social worker. I am not a medical professional like a nurse or a doctor. So I'm bringing you information. Actually, you could probably find pretty easily if you Googled these topics. However, when you Google something, you get like a million things that come up. It can be kind of overwhelming. We don't know where to start, what's going to be reliable. So my goal today is actually just to in the presentation, take away some of the stress of weeding through all those things and give you a basic overview. I am going to share the resources at the end and encourage you to kind of do your own deep dive, maybe into something that you want to know some more about, and use the things we talk about today as a springboard of what to talk to your health providers about. So let's start by talking about healthy living. I want you to just take a minute and think carefully and reflectively about what this means to you. What does the term healthy living mean? Does it mean the food you eat, the exercise you do, or maybe don't do? Is it something in the environment around you? When I finished my cancer treatment many years ago, I had this idea that I had to get healthy. And to me, what that meant was I had to choose only healthy foods to eat, and I needed to exercise more and regularly. And for many years, that was my definition of healthy. That it was what I ate, and it was that I needed to be exercising. However, in the past few years, my understanding has really deepened and broadened in this area. So you may have heard the term blue zones. Blue zones is a buzzword right now. And if you're a Facebook watcher, or excuse me, a Netflix watcher, you may have seen a documentary recently that just came out called Living to 100 Secrets of the Blue Zones. It's a documentary by Dan Buettner. And what the blue zones are areas where there's unusual longevity, where there's a lot of people living who have lived to almost 100, sometimes even over 100 years old. And in the documentary on Netflix, Dan goes into some of these areas and he tries to find out the secret of the blue zones. And just a fun little fact, they're called blue zones because when they were first kind of discovering there were these pockets of places where people lived longer, someone circled them with a blue marker, hence the term blue zone was born. So you'll have to watch the documentary to see the beautiful scenery and to hear what he has to say and to learn more. But what I thought was very interesting was there wasn't one food that they found that was like the secret to living to being 100. There also wasn't an exercise program that was the key to living to be 100. But there were some common denominators between these communities. And these are the things that he discovered how these people were living longer without trying. They live close to nature. They love deeply. They eat simple foods that were raised sustainably, and in a lot of cases in their own backyards. They move naturally. They laugh. They rest. And they actually just live. So at Cancer Support Community Delaware, our healthy lifestyle classes are intended to help you foster some of these very same practices. And community is in our name. A community is an important part of that. We have walking groups both in Sussex County, also here in Wilmington at Winterthur. It helps you move, get out, be in nature. In our nutrition classes, our instructors use simple ingredients that are local and of the season that we're in. Things that are healthy for you and things that can boost immunities through your cancer journeys. Yoga and Tai Chi classes help us move and move in ways that our body can do naturally now. Because the way our body feels, the way we can move today might not be the same as next week or even next month. So, those are great practices that are easily adaptable to where you're at. Meditation and sound meditation teach us to rest our mind. And not only do you do that when you're in the class, but it teaches you skills you can use outside of the class. Opportunity to laugh and create friends and community is woven through all the classes as well. So all these things you might be thinking to yourself, that kind of sounds like some really good self-care. Well, another piece of self-care that is really important to living our healthiest life is in the area of preventative care for our healthy bodies, our physical bodies. So let's talk a little bit about screenings and prevention. I often hear you talk in support groups about, I just can't add one more ologist or one more ist to my many list of doctors that I already have. I have a radiation oncologist, I have a medical oncologist. Now I need a cardiologist, a dermatologist, a nephrologist, and the list goes on, right? But instead of adding another doctor, a test, or a task, let's try to think of this as adding another tool to our healthy handbag. Here I have listed the top four, five if you're high risk for the last one, screenings that we should be doing regularly because we know that early detection of anything that might be going on inside of us provides the best outcome. I'm not going to give you like the ages, the years, when to start, when, how far in between. Some of that will be in the resources. And also, it's going to be individual for each of us. And we need to ask our healthcare providers about that. But my intent is to get these on your radar and encourage you to make sure they're part of your regular checks if they're not. So, of course, the first one I think we always think about when we're talking about screenings, especially with October coming up, is screening for breast cancer. So, getting a mammogram, maybe for you, it's also an MRI, also doing self breast exams. And even if you've had a mastectomy, it's very important to check the skin and area around where your breast area is because lumps can still occur there. So, that's our first one. Secondly, cervical cancer we can screen for with a pap smear. Most are recommending to do that yearly, and younger people should also be getting an HPV test at the same time. A colonoscopy is a great way not only to catch early colon cancers, but to completely avoid them. Any polyps that they see that could be precancerous can be removed during the procedure, and then you're ahead of the game. A skin check every regularly is very important as well. And while your primary provider can do this, it's important that you have a good dermatologist. A dermatologist will get in all the cracks and crevices and really check you well and know exactly what to be looking for. My personal recommendation from my healthcare team was to go twice a year for my skin check. I have a great dermatologist. I schedule my next appointment that's 6 months out every time I go in to make sure I don't miss that. And then lastly here, if you're a smoker, if you have history of lung cancer, or maybe you're genetically predisposed for this, be sure to be getting regular CT scans to look for lung cancer. So some of our screenings that maybe aren't cancer related, but are really important for our health include things like blood pressure. Now, if you're at the doctor regularly, if you're in treatment, you're probably having your blood pressure looked at pretty regularly. But sometimes our caregivers, or even as we're in the survivorship after treatment, we don't think about this one. So be sure you're getting a regular blood pressure check. It lets us know if anything's going on with our heart or cardiovascular system that we might need to address. A blood sugar, which is done through a blood test. When we look at that, we're looking for any pre-diabetic or diabetic issues that might be going on. Cholesterol, also through a blood test, we'll look at your LDL and your HDL. Blood sugar and cholesterol are done with a fasting blood test. And, real easy. Don't you just can't eat in the morning. Go in, get your blood test, and then you can have your coffee after that. And these first three, when our numbers get kind of wonky, when our results come back, we can make some interventions either with eating a little different, maybe putting some exercise in, maybe a little bit of medication, but something that will kind of maybe help change the trajectory before things get worse and we are experiencing other symptoms. So, bone density is another thing we should be looking at regularly, especially as we're aging. We can have osteopenia or osteoporosis, which is the weakening in our bones. If you've had a lot of chemotherapy, you can also have these happen to you at an accelerated rate as well. So, my recommendation from my doctor is to go every 2 years. I get the DEXA scan, very easy. You lay on the table. It's one of the easiest tests we have. You lay on the table, the thing just runs over the top of you. If we're showing that our bone density is not great, easy interventions with medications that we can take to avoid issues of broken bones or other things further down the line. So you're probably wondering, why does she have sexually transmitted diseases on here? It's not something we talk about in normal conversation or that we hear about very much. But I wanted to remind you, if you have multiple partners now, if are you sexually active with someone who may have had multiple partners, it's not a bad idea to have a screening for sexually transmitted diseases. It can be done through your regular blood test when they're checking your blood sugar and your cholesterol. Again, early intervention to take care of those is your best option. We also should have a regular mental health check-in. Often when we go to our regular checkups at our PCP once a year, they'll do a screening. And sometimes also at the oncology office, they'll do this. We do it as well for our participants and caregivers, just a quick, easy distress screener of 15 questions. And sometimes we don't realize, like, I really am experiencing more anxiety than necessary, or I really am more sad than I realized, and maybe I am experiencing some depression. So again, we can have earlier interventions with maybe going to a support group or getting some individual therapy, possibly even some medication can really help us to avoid bigger struggles down the line. And then the last one I have here is just a dental checkup, which I don't really always think about this when I'm thinking about healthy living, but having a healthy mouth, healthy gums is so important to the rest of our health as well. And if we're going through treatment, especially if we're about to go through treatment, it's so important to go in with a mouth that our fillings have been filled, our cavities have been filled, we don't have loose fillings. So we're in the best shape we possibly can be. And if you do not have dental insurance, if you do not have insurance that covers some of the screenings I previously talked about, there are many resources in Delaware to help pay for these. And I've links for those in the resources that you'll be getting at the end. So as we wrap up today, I want to send you with 3 for the road. So first of all, whether it's when I'm done talking, or maybe later today, or maybe tomorrow morning when you're having a quiet moment and a cup of coffee, I want you to think again about what healthy living means to you. So, like I said, my definition broadened and deepened. So maybe yours has broadened and deepened a little bit today. Secondly, take a moment to recognize where you're doing well. Show some gratitude for yourself. What are you doing and doing well? And say thank you to you for that. And lastly, make a plan to move a little closer to that vision of what healthy living is for you. One of my favorite expressions is, how do you eat an elephant? One bite at a time. An elephant's pretty big, right? So one bite at a time doesn't seem as overwhelming as trying to stuff the whole thing in your mouth at once. So, if our vision of healthy living is this big, think of maybe one thing you can do this week, an appointment you can schedule. Maybe you're just going to commit to taking a walk every Monday, Wednesday, Friday. What's one little thing you can do this week to move a little closer? And the more small steps we take, um, the closer we move towards our vision of healthy living. So, if you're watching me on Facebook, I am going to provide the PDF of resources in the comment section. Otherwise, you can see my email posted here. If you reach out to me, I'll be happy to share them with you. And I want to thank you and wish you a very healthy day.